good afternoon, everyone. Thank you all for joining us for our Hello Health session for this month. For those that don't know, my name is Caroline Price, and I'm the Administrative Officer, too, with our Connected Care program here at the Health Department. Before we get started today, just want to provide you all with a few quick housekeeping points. Any links and resources that are shared during this episode will be posted to our website at cumberlandcountync.gov. You will also see the links on your screen as well. If you missed the session today, you can watch reruns of it on Cumberland County NCTV as well as on YouTube. Cumberland County, North Carolina TV is a 24-hour channel that focuses on Cumberland County government. It airs 7 days a week on Spectrum Cable Channel 5. You can also stream it on the app on Roku, Apple TV, and Fire TV for free. And as well, please visit our website, cumberlandcountync.gov/health. So we will go ahead and get started with our session today, and I will go ahead and let our speaker introduce herself.
Hey, I am Samantha Tillman. My pronouns are she, they, and I am the Reproductive Health Education Specialist in the Health Education Division of the Cumberland County Department of Public Health.
Perfect. It's a mouthful.
It is a mouthful.
Yeah. So we will go ahead and get started. Today's topic is the Breast and Cervical Cancer Control Program. So, Samantha, just kind of get us started. What is this program? How does it assist individuals in accessing cancer screening?
Yeah, so we call it BCEP, so it stands for North Carolina Breast and Cervical Cancer Control Program. So we just call it BCEP for short. And it helps individuals by helping them get screening. So people who are underinsured or don't have insurance and they really need to get those preventative screenings for breast cancer or cervical cancer can come here and utilize our BCEP services.
Perfect. So how would you say that early detection of breast and cervical cancer can impact overall health outcomes?
I mean, it's hard to put a number to it. It's super, super important to get these preventative screenings, especially if you have any family history, because the earlier you can catch it, the earlier you can treat it, and, you know, your overall health outcomes are just a lot better. So just making sure that you're staying on top of it. So for breast cancer, if you have family history, make sure you're starting to get your mammograms at age 40. If there's no family history, it's usually between ages 45 and 50. And then for cervical cancer, that's going to be getting your pap smear every year. So every single year, so we can make sure all of the cells on your cervix are normal. Usually, we try to say for cervical cancer, you should start by your 21st birthday. We do say, like, if you are sexually active before that, then go ahead and start.
Okay,
yeah.
Perfect. So what, if any, are the eligibility requirements for receiving services through this program?
Yeah, so for BCEP, you have to be at least 21 if you are seeking services for cervical cancer. If it's for breast, it's at least 40, up to age 64. You cannot have Medicaid or Medicare Part B. You have to be uninsured or underinsured. And a lot of people seem to be confused about the term underinsured. That just means that you have insurance, but it doesn't cover all of the screening tests.
Gotcha.
And then you also have to be at or below 250% of the poverty level.
Okay.
Yeah.
So how do the screening processes for breast and cervical cancer work?
So the screening processes are really simple. So for cervical, the pap smear, that is just where you go to your gynecologist and they just take a sample of your cervical cells and they just look at those cells under the microscope. It takes no time at all. And then, of course, if those cells come back abnormal, then they would go from there. And then for breast, obviously, self-exam. Self-exam is the first step. You should be doing self-exam every month. Okay. Every single month, every month, everybody. So once a month. Other than that, the screening is usually you just go to your gynecologist and they'll do a physical exam where they feel for lumps or abnormalities in your breast. And if there's anything that is a cause for concern, then you would get a mammogram, which is just using a machine to it sounds terrible, to flatten out your breast. It sounds very painful, to flatten out your breast, just so they can get a better, kind of like almost like a topographical kind of map thing of the breast tissue to see if there are any lumps in there.
Okay.
Yeah.
And so just to piggyback off that, when you look at doing a self-exam, there's been, myths and things in terms of referencing laying on your back. Can you give us kind of just a clear process as far as how that goes if you're doing a self-exam?
Yeah, so usually you just do it in the shower, and we tell people, you can just lift your arm up because you do want to try to get close to your armpit as well, because our, breast tissue goes all the way to the side, and then like our lymph nodes that are connected to breast are in the armpit. So a lot of people do it in the shower, and that's just because like the having water and soap allows you to kind of like feel over it a little easier. There are some people who like to lay down in bed and do it. Both are really acceptable, but if there are any questions about it, definitely just reach out to a doctor so they can kind of give you some advice on that.
Okay, perfect. So what is, I guess, some more information that women should know about the importance of getting screened on the regular?
Yeah, I mean, the importance is catching anything early. The earlier, the better. With breast cancer, if you catch it super, super early, you might not even have to do chemo and radiation. It might just be they take out the lump and you're good to go. And so really, being able to catch it early saves your life.
Mm-hmm.
Yeah.
So what are some of the common barriers to accessing cancer screenings, and how can those be overcome?
Yeah, so there are quite a few. First, financial. Sometimes, we just feel like we don't have the money to be able to get these screenings, especially if we don't have insurance. Logistical, if you don't have transportation.
Mm-hmm.
Another one is the clinics that are around you, the hours. If you work until 5 o'clock every day, but the clinic closes at 5, when are you going to go?
Mm-hmm.
And then sometimes a language barrier.
Mm-hmm.
So if you, in Cumberland County, we have large Spanish-speaking population, Haitian Creole speaking. So if there's no provider that understands them, then they're less likely to seek services. So luckily, the health department, we have things that help to lower these barriers.
Mm-hmm.
So we have the BSEP program to help financially. We have Uber Health to get you to the health department for your appointments. We have a late clinic night every second Tuesday of the month. So we're open until 7 o'clock. And we have in-house Spanish-speaking interpreters, and we also use a language service for any other language. So we try to really reduce these barriers to get patients in so they can get the services that they need.
Yeah, it kind of seems like the health department is definitely a one-stop shop. You kind of have all the needs.
Yeah, we definitely try to be, which, of course, when I was growing up, I didn't know any of that. I really didn't know about all these things the health department tries to do until I started working here.
Mm-hmm. Yeah, it's definitely, the more kind of you're involved in those things, you kind of enlighten yourself a little bit too, which kind of helps us in turn enlighten the community as well.
For sure.
So how would you say that the BSEP program supports women throughout their treatment journey if they do become diagnosed? So
if someone is diagnosed, we do some diagnostic things, but as far as a lot of support, we do try to connect them with other organizations that have support systems. So Cape Fear Valley helps to connect people with support groups for like social support, as well as Susan G. Komen Foundation, the American Cancer Society. I think the headquarters for our region is in Raleigh, but they really try to reach out as far as they can. And then the Pretty in Pink Foundation, which serves only North Carolinians who are going through breast cancer. So we try to give them lots of resources for different places. And of course, we're always here if someone just needs to talk through their journey. Mm-hmm. Our BSEP coordinator, Tanya, can definitely sit down and just have a conversation with them.
That's good to know. So are there any new developments or improvements in cancer screening technology?
Yeah. I know when I was growing up, like, I don't know about you, but when I would hear women in my family talk about mammograms, I just imagined these metal plates just squeezing the mess out of your breast, and it just seems like such a painful thing. And so they really tried to make the compression plates have some curve in them, so it'll be a little more comfortable. But there's also some new technology to where they're using like dyes to do like MRIs and different imaging to better see any of the abnormalities or the cancer cells. So really just trying to make it as easy as possible to see any changes. And I would say as far as treatment, Cape Fear Valley does have a new way to treat for radiation. So usually you would lay on your back and the radiation is shot through, your breast, which means it's also going through your chest. And so there are some cancer patients who end up having heart issues, lung issues, because that radiation is hitting all of these, parts of you that don't need to be treated. And so now they have a machine where you get to lay on your stomach and your breast. There's basically like a hole that the breast can fall through. Okay. So the radiation is only hitting the breast and nothing else. So they've seen a lot less complications from using that.
Okay. It's new information. I didn't even know.
Yeah.
That's awesome. So how would you say, we kind of touched on this a little bit, but how would you say that individuals can learn more about the BSEP program and how to access it?
Yeah. So BSEP, I will say BSEP is at most health departments in the state. So though I like to say all the time that here at Cumberland County, we are special. But when it comes to the BSEP program, there are lots of other health departments that have it. And so if you have any questions about whether or not you're eligible, or if you just want more info, you can definitely just call us. You can just call our main number, 433-3600, and just say you want to talk to BSEP, and they'll patch you over to Tanya.
Perfect. It's pretty simple and straightforward there.
Yeah.
So, what as far as community partnerships would you say currently exist that can help to improve breast and cervical cancer awareness?
Our biggest partner is definitely Cape Fear Valley. They have a very large cancer center. They do tons of things for our breast cancer patients. They are very much in tune with patient needs. I know that once a patient does get diagnosed, there's no wait time before you speak to anybody. You will immediately meet your care team. And so we try to partner with Cape Fear Valley just to make sure that we are, still giving out good information, but then just letting people in our community know that Cape Fear Valley has a lot of resources that are super, super helpful.
Yeah, I think it's kind of helpful to know, especially locally for folks here that's right in their backyard. Yeah. So, if you have a question or if something comes up, and you can always reach out to us here at the health department, but also they'll get you in contact with folks at the hospital if that were to need to happen as well. So
yeah, and then we are trying to tell more people about the Pretty in Pink Foundation, just because it's the only organization in North Carolina that supports North Carolinians. So none of their finances, none of their support goes outside of our borders. So they help people in our communities, maybe our neighbors, pay for their cancer treatments. They also provide comfort measures, comfort care. And something I recently found out is mastectomy bras. Because that's something that, we don't always think about, is if someone just gets one breast removed, how do they wear a bra? So there are special things that Pretty in Pink Foundation does for people in our community who are facing breast cancer.
That's awesome. That's a super helpful resource, sounds like. So well, thank you so much for being with us today. So
thank you so much for having me.
Absolutely. Yeah, it was very beneficial information for sure. So just kind of want to touch on a few quick housekeeping points again. Again, thank you all for joining us today as well. We really appreciate you all being here with us. And again, just want to touch back again. Thank you all for those of you that shared any photos from Breast Cancer Awareness Month. So if you have not done that yet, please feel free to continue to do that. Just make sure that you all take our survey. Make sure you tell us how we did. That survey is available on our website. Again, any links and resources that are shared during the episode today will be posted on our website at cumberlandcountync.gov. Again, if you did miss the session today, you can watch reruns on Cumberland County NCTV as well as on YouTube. And again, make sure that you tune in to our session next month. So thank you all for joining us. Have a good one.